Hello, my name is Hunter Mehaffey. I'm one of the adult cardiac surgeons here at West Virginia University Heart and Vascular Institute. Today we're going to talk a little bit about veno-arterial and veno-venous extracorporeal membrane oxygenation, or ECMO. So there are two different types of ECMO support that can be provided depending on what the patient needs. Veno-arterial, or VA ECMO, provides support for both the cardiovascular and the respiratory or pulmonary system. So for patients that are in cardiovascular collapse or shock, whereas veno-venous ECMO or VV ECMO provides oxygenation or just respiratory support for patients in respiratory in severe respiratory failure. First, we'll start by discussing veno-arterial ECMO or VA ECMO. For this, patients have inadequate cardiac output, or the heart is unable to provide enough flow to support the body, and we use the VA ECMO circuit to provide additional flow as well as oxygenation and delivery of oxygenated blood to the body. To perform VA ECMO, you need two cannulas, one placed on the venous side of the body, either through the groin or the neck, or in some situations can be placed centrally if the chest is open, and placed directly into the right atrium. This allows venous blood to be drained from the body, passed through a membrane oxygenator, and then through a pump to pump it back into the body. For VA ECMO, the second cannula is placed somewhere in the arterial system, either in the groin, the femoral arteries, sometimes in the subclavian arteries, or sometimes directly into the aorta, which would be the case if the chest was opened. Therefore, this VA ECMO circuit drains venous blood, oxygenates it, and pumps it back into the arterial side of the body, therefore doing the work of both the heart and the lungs to support the patient in cardiogenic shock. Alternatively, VV ECMO really only provides oxygenation. Therefore, again, there are two cannulas, one that are both on the venous side of the body, so either neck and groin, or there are special cannulas where you can insert one cannula that has two lumens, one for draining blood out and the other for reinfusing the oxygenated blood back to the body. For VV ECMO, we drain venous blood, pass it through the oxygenator and the pump, and then it's pumped back into the venous side of the body and flows through the heart in the standard pathway, through the lungs, and then the heart does the work of pumping the oxygenated blood back out to the body. This provides oxygenation but does not provide cardiac support or flow to take over the job of the heart. This option is best for patients with respiratory failure, most recently in the COVID pandemic, or with severe flu or pneumonia. And these are the basic concepts of the two different types of ECMO support. Now, there are variations on each of these. There can be additional drainage cannulas to provide more flow, as well as, depending on the area of the body for VA ECMO, where blood is being reinfused, sometimes, especially if the femoral artery is used, we have to provide flow down the leg, and additional cannulas are used for those indications. But this is a very brief overview of the two different types of ECMO. Thank you.